Hi, my name is Shari Chavez and I'm the Far West Division Chief Nurse Executive. I would like to take just a few minutes of your time to talk about a topic that's very important to all of us right now, and that is the COVID-19 impact on healthcare providers. But before I get started with the question and answer segment of this video, I would like to define the term hero. What is a hero? A hero is a person who is admired or idolized for their courage, outstanding achievement, or noble qualities. COVID-19 has landed us in uncharted territory, and the fact that day in and day out, you all continue to come back to the bedside and support your patients and the community is truly heroic. I am truly humbled by your efforts and have never been more proud to be a nurse and to support the nurses across our division. From the bottom of my heart, I thank you. At this time, the answer to the question of whether or not we have enough PPE is yes. Through proactive measures that started weeks before the pandemic, the Far West Division and HCA Healthcare have implemented a thoughtful and pragmatic approach that has allowed us to maintain our PPE levels. I can assure you that our employees are protected. We are aware that external organizations, including California Nurses Association, National Nurses United, and National Nurses Organizing Committee, are speaking out on a variety of issues. It is our concern that they are adding to the confusion, misinformation, and fear spreading across the healthcare industry in the United States. This is not a time to create conflict and dissension within healthcare organizations that are doing everything possible to protect caregivers and patients. As with any matter of medicine, there are competing opinions between professionals and professional organizations, such as the CDC and the World Health Organization. Because our priority is to protect our colleagues so that they are able to care for our community, we are following the CDC guidelines as the United States' leading public health expert on infection prevention. Recently, HCA and the Far West Division enacted the Pandemic Pay Continuation Program. For colleagues working in patient care facilities, if a colleague is quarantined per the CDC guidelines and works in a patient care facility, we will pay 100% of base pay for scheduled hours regardless of where the exposure took place. Any colleague who does not work in a patient care facility and is quarantined per CDC guidelines may be eligible for short-term disability or leave of absence while they are ill. I want to take a moment to remind everyone that in regards to COVID-19, we are in mile 5 of a very long marathon. Please take care of yourself and your families. And again, thank you for your dedication to our mission. Care above all else.